Hi, I'm Dr. Margreet Wibbeling, midwife specialist and your host of the Birth and Baby show, brought to you by Sister Lillian Center and Sensitive Midwifery. We empower moms and midwives to have the best birthing and parenting experience through natural, physiological, and intuitive care, resulting in birth and baby advice you can trust. Welcome back to another episode to our lovely Birth and Baby show, Advice You Can Trust. And for today, we will be talking all about breastfeeding, as it is Breastfeeding Awareness Week. And awareness is extremely essential because breastfeeding is just the thing to do. It's natural. It should be the thing to do for every mom when she has a newborn and a little baby growing up. Unfortunately, we see that the breastfeeding numbers are quite low, way below what it should be. I think we're currently on about 30%. So that is why awareness is so important. So in this talk, we'll be talking about why it is important, also the threats that on breastfeeding, why it is not successful sometimes, and then some practical tips. We're in for a treat, very important talk, but I've got a very special guest. She's absolutely passionate about the breastfeeding topic. She's actually also highly researched in and around the topic, currently doing a doctoral studies, and she is researching innovative ways to assist women in breastfeeding practices in an unfavorable work environment. She's an advanced midwife, she's a mother herself, and we can't have a better guest for this show. Reviewwe Maponya. Enjoy it. This episode is brought to you by Baby City, our preferred baby store. Well, this is a one-stop shop where you can get all your baby products and beautiful baby brands at the same place for very affordable prices. Go to babycity.co.za for your online shopping, or go visit a baby store. They're all over the country. And you will also be able to get your antenatal checkups done. Hi everyone, welcome back to another episode. And guess what? We are going to be talking about breastfeeding. And you guess why? Because it is Breastfeeding Awareness Week. And obviously we are all for breastfeeding and awareness. We can't bring enough awareness when it comes to breastfeeding. So we are going to be talking all about it. And for this specific topic, I've got a very special guest. Her name is Reveelwe, and she's actually been a guest with us before. She is an absolute breastfeeding lover, breastfeeding guru, breastfeeding specialist, everything. Apart from that, she's a midwife and currently practicing as an advanced midwife in a maternity unit. So she's right there, hands-on, practical, and you're going to be learning so much from her. So welcome, Reveelwe. I'm so happy you're here. Are you there?
Thank you for having me, and I am happy to be joining you.
Oh, Reveelwe, am I saying your name right? Because you also have another name, Nompumelelo.
Yes, you are saying it right.
Okay.
Even Nompumelelo, which is very long, you are also saying it correctly. Thank you for that.
Great. So, Reveelwe, tell us a little bit more about yourself and your work as a midwife, and also why you are so passionate about breastfeeding.
Okay. I am an advanced midwife and neonatal specialist. I'm currently working under the Rustenburg sub-district in a rural clinic in Chaneng. I completed my undergraduate at the Northwest University, Potchefstroom campus, where I developed my love for midwifery. And then this love went forward where I did my community service in a provincial hospital, which was in Rustenburg as well. It's called Job Shumankane Tabane there, where you have your South African Breast Milk Reserve Bank there, your neonatal ICUs, and your maternity unit, which I was exposed to that. So I was also a breast milk donor back in 2020 and 2021 respectively. I was breastfeeding my own baby. And then I moved from there to join South Rand Hospital, which was in Gauteng. I was also exposed there in their maternity unit. So I have been exposed to 3 different levels of care, which is your provincial, your district hospital, and now your clinics. So it's actually a vast knowledge that I have. I've also looked in the private hospitals. So I've got quite a knowledge of each and every domain, and I like to use it and refer back to it. So currently I'm a PhD candidate at the University of Johannesburg, where I'm pursuing also studies regarding breastfeeding.
Wonderful, wonderful. Now you're a very passionate midwife. I can hear, and with so much different experience. So thank you so much for being here with us today. And we're going to be talking to mostly, I think, mothers and mothers-to-be, and sometimes also midwives that are listening and birth workers in and around breastfeeding. So, Reviewer, for you, when you hear breastfeeding awareness, what does it mean for you? Why is awareness so important? Why is it so needed?
Awareness is important because currently in our country, South Africa, our breastfeeding rates are low. So we are looking it in the eye of why is it low? Because breastfeeding is thought to be a natural thing, but actually it's not. It's a learned behavior. So with all our mothers that we come into contact with, we want them to be aware even before conception. It's very important to have the awareness before conception, when you have conceived, and when you now have your little one there with you in your arms, because it's what we preach to them. But we say, practice what you preach. Because if you can't practice what you preach, then you are not giving the mother that support that she needs, because she's counting on us as midwives, as people who have this vast knowledge and trust that she's able to do it. So creating the awareness for not only her, but her spouse, her partner, her family, and within the community, because they trust in us. Mm-hmm. And when they look at us, they know that even if I can't do it, but when I'm with my midwife or my doula or my professional nurse, they know that I can do it, because this person, I'm counting on them. So the awareness, we can't stress it enough. It's a week, but it should be done 365 days. So that's
true,
my
so true. I love what you say. It should be awareness every day, especially as a midwife, right? But
Yes.
it's, for sure. So, Review, you were mentioning that breastfeeding should be natural and everyone should be doing it. It should be just, the most natural thing. And you say that our rates are very low. So let's unpack that a bit. Why do you think is that the case, and do you know the number, how low it is, just that we can all have a bit of a reality check? And also, then what are the threats to breastfeeding success, would you say?
Thank you for that. Let me start with the statistics. In 2016, because now we have been doing the statistics for this year, so we've got the statistic for 2016, we had the rate of 32%. Which is very, very low, because we had to have a 75% rate for us to say that we are actually winning as a nation. So we are very poor. Worldwide, we are not the only ones. Worldwide, all the countries, some of them, the highest was 44%. So we are all lacking in this part, because it's not something you can measure. You understand? And it's not something that is economized, because it does not really contribute specifically to the economy. It can't be measured in the economy. We can only measure it by sick babies that are being admitted, due to what we call substitute breastfeeding. Breast milk, sorry. So substitute breast milk is when you are giving alternative feeding, which is in the form of porridge and formula and feeds other than breast milk. So which are a threat to our baby's well-being and health and growth and development. So those things are only measured economically when we are having such things as malnourished children, stunted children, or obese children, or kids who die under the age of 5 years related to nutrition. So you see that that's the only way we are able to measure that our babies are not really getting the breast milk. So that is how we can quantify it. What are the threats to breastfeeding? Undermining the mother's effort. When we say undermining the mother's effort, we are not giving really enough education to the mother. Why are we saying that? Mothers know the benefits of breast milk for their babies. Some of them, they don't know it for themselves. What is the benefit to the mother herself? They don't actually know it. When you do your research and you ask your mother, even if she's having her third, fourth child, they really don't understand. They will say, no, it's only good for the baby because it's got nutrients. But even those benefits, when they explain them, you can hear that they are lacking. They are just knowing the surface. They don't really know the core of why they should be breastfeeding, And then also the benefits to them as well and to their family as well, which is financial aspect, to the community as well. So it's a broader thing, and it's like a wave that is being rolled out, Another threat to breastfeeding is substitute foods. When we mean substitute foods, I must elaborate that within the first 6 months of the infant's birth, which is your baby's birth, you are supposed to breastfeed your baby only breast milk and only give supplements or vitamins that are recommended by your doctor, your midwife, or your professional nurse. So when you are giving those things, which is medication, it is something that is prescribed. So that is not part of mixed feeding, mixed feeding is giving breast milk both with formula or porridge or water and all those things. So when you are giving your baby exclusive breastfeeding, which is only breast milk for the first 6 months of life, that is exclusive breastfeeding. That's what you are giving for your baby. After 6 months, you introduce now nutritious foods that are prepared by you. Sometimes you give your commercial prepared nutrient food like your Purity and all that. But we prefer for you to prepare the baby's food by boiling them and giving the baby all those wholesome, nutritious food from 6 months and beyond. But you still continue to give breast milk. You still continue to breastfeed your baby. So those are the aspects that we need our mothers to understand. Now, another thing that is threatening our breastfeeding is the introduction of what I said is breast milk substitute, which are all other things except breast milk. So when you are introducing those things, the mother either does not breastfeed at all, or she feeds in intervals, So the baby is not actually receiving the nutritious aspect of the breast milk. So which undermines the effort of the mother to breastfeed. Ultimately, she will leave breastfeeding because she's able to say, but my baby is getting more food from the porridge and from other things or from formula milk. But the quantity and the quality of breast milk cannot be replaced at all. It's something that is unique in all its content, in all its ingredients. And I can't stress the emotional attachment that goes with breastfeeding. And it's good for the intellectual of the baby as well. You are able to actually even recognize as a mother that my baby is not well today. By even holding your baby close to your breast, you are able to recognize immediately, even if you don't understand the condition. But as a mother, you are attached to this person. You can see this person is not playing as I know this person, So those are the things when you are able to breastfeed your baby, you are able to understand. But because of other methods of feeding and the lack of support, even in the workspace, the lack of support, it coerces the mother, it enforces the mother to go to other methods of feeding, which undermines our effort to breastfeed our babies.
Yeah, so that's an important thing. So for the threats, you say that we're undermining the ability of the mother to breastfeed. And then you say it's also another threat is the adding of other kind of foods. So not purely only breastfeeding and the lack of support. So reviewer, every mom, she starts off probably in a maternity clinic or a hospital or birth center, and she's surrounded by midwives and nurses and so forth. So that should be those first hours, first days. I mean, even the first hour after birth and the first days, you and me know how important that is. Let's just explain how important those days are and to set you up for a successful breastfeeding journey and why it is so important not to add any milk. How does breast milk work? What is important in those very early hour and days to set you up for a successful breastfeeding journey?
Thank you for that, Doc. You know what? The first hour after giving birth, that is when the baby is alert and the baby is awake. So your baby can even crawl when they put the baby on your chest. It's a miracle because they can crawl, they hold up their heads and they are looking for that breast. They can smell the colostrum, which is the first milk that is expressed from your breast, which is full of nutrients and it's very thick. So when your baby is put on your chest in that first hour, trust you me, your baby will start crawling. We call it a miracle as midwives because it is something that we also don't understand, but we can see that it's happening. So your baby is put on the breast, your baby latches on, meaning your baby is opening the mouth and searching for that breast. You put in that areola, which is your black part of that breast, all of it in the mouth, and your baby will start suckling from it. So that first hour is very important. So I'm going to stress this. Even if that first hour, there was a bit of complication and then the baby was resuscitated, the baby is fine, is able to suck, put that baby on the breast. Put that baby on the breast. We can't stress it enough, even after a C-section, because sometimes you are separated from the baby. You have to be sutured first before you and your baby can be reunited again. Put that baby on the breast, even in recovery. I can't stress it enough. That first hour or that first contact is very, very important because now that baby is alert and awake and is ready to feed. It's like they are born to feed. It's like it's within them, which is very miraculous. Now, when we initiate it and the baby is able to breastfeed nicely and attach, it's beautiful. Along the way, which is what we call continuation, the few days, learn how to do your positioning because our mothers, they only know the upright sitting on the chair position or sitting on the bed, which sometimes it can be a very discomfort, you know. You want to just lie down on your side, change your position, use your pillows. Please, even as midwife, we must educate the different styles. Because it's every time you watch sit up and you are in pains, you have an episiotomy or you have sutures or you have a Caesar and you can't even sit up. All the positions are important. Find your comfort. And then know that your baby is going to be relaxed. You are going to be relaxed and your baby is going to breastfeed. When your baby is continuing the let down reflex of the breast, that means the flow out of the milk will increase and your baby will be breastfeeding and the baby will sleep after that. That's when you can rest. So those critical moments when you are in hospital or when you are in your clinic or in your birthing unit are very important. Ask questions. If you feel like you are not doing it right, ask so that we can correct you. Sometimes you are on the right path. You just need that support saying you are doing it right, mommy. You know, because sometimes you feel like, hey, I don't know if this baby is latching on correctly. But you'd be amazed that your midwife will be smiling and looking at you, knowing that you are doing it correctly. But we need to hear those words as mothers, that you are doing a correct job. Continue. So when you go home after you are discharged, we really need to emphasize as midwives, when the family comes to collect, that continue breastfeeding the baby. Even when they're here, you educate them a bit more. Continue breastfeeding the baby, only breast milk until 6 months, because also the family's opinion of breastfeeding, it matters a lot, because we are discharging them to them. So if they're not on board with the idea of exclusive breastfeeding, when the baby cries because of anything, they will say the baby is still hungry. Yes. So if we are not all on board on that, the baby will receive other alternatives at home.
Yeah.
So when we put the grannies or the sisters or the aunts and the fathers all on board, when they come and collect, to say the baby is drinking the breast milk, fine, don't worry. The baby is supposed to cry. I always say that to all my clients. The baby is supposed to cry. The baby is a human being. They can't talk. That's how they talk. It's like when I say I'm crying because now I want to change position. I've been lying in one position for long. I'm tired. I want to be held, So they cry, for instance, for that. I want my nappy to be changed, So the first 3 months after the birth of the baby, it's a critical stage. We call it the fourth trimester in the midwifery term, because your baby is coming from your stomach. Your baby was hugged by your stomach in a dark place that was warm in water. Now your baby is coming to a noisy, light place where everybody's talking, where everybody's holding the baby. When your baby was in the stomach, nobody was holding your baby. Your baby was being hugged all the time. So now when your baby is outside, everybody wants to play with your baby, the noise, So your baby is also overwhelmed with everything, the transition. Your baby is overwhelmed. So you can understand, if you put yourself in your baby's shoes, that when I say I want to be hugged, because I come from a place where I was hugged all the time, So when I need to be fed, feed me, love me, hug me, hold me. And you never get that chance again, because they are growing up. So you never return back. Once you start it right, you are laying a foundation for your baby. So that I can't stress that enough. And that foundation, you are laying it because in future, when you have breastfed your baby, you are lowering the risk of obesity and, chronic hypertension and all those chronic diseases later on in life. So you are laying a very important foundation. You can't build a house without a foundation. So why you want to rob your baby of that foundation of breast milk?
Yeah, absolutely. Yeah, so you're passionate. I love it. You said so much. Reviewer, I know how moms think, and especially in the beginning, they always worried it's a trap, that they won't get enough milk, the baby's not getting enough milk. So maybe you can just explain a little bit how the breast feeding cycle works, and also why it is so important that a baby don't get top-ups, and that you need to, what I'm after, right? The cycle or just explain it, because once you understand that, then I think you learn to trust more in your ability to give enough milk without being able to measure it in a bottle, and also that your body will know how to give baby enough milk.
So I'm going to explain it in simple terms. So as soon as your baby is latching on, meaning as soon as your baby is sucking from the breast, it's called a suckle reflex, which stimulates or send messages from your breast to your mind. We call it a pituitary gland. So there it stimulates a hormone called prolactin, which is the hormone that will produce milk. It's telling your brain, your breast is telling your brain that, no, you need to produce more milk. Somebody is sucking from my breast, and then it gives the signal, goes back to your breast and produces more milk. That's why in the first 3 days or a week, you will have an enlarged breast because of the milk that is being produced. You will see even the milk will be coming out on its own, because your body is recognizing that now there's somebody who's suckling from my breast and I'm producing more milk. So the more the baby is sucking from your breast, the more the milk is produced, So even when you are expressing with your hand, you are mimicking, meaning you are mimicking those suckling reflex of the baby. And your brain will go and say, somebody is suckling, even if you are doing with your hand or with a breast pump, and you are going to produce more milk. The problem that I see with most mothers is that we want to quantify. We want to be able to measure how much your baby is breastfeeding from you, how much milk she's getting, because you are unable to measure when you are directly breastfeeding your baby. So you are unable to see, is this baby suckling or getting enough milk? Trust your body. Trust your body. Your baby is receiving enough milk. Your breast milk is broken into two components, your hind milk and your fore milk. Your fore milk is the watery part, and your hind milk is the a nutritious part where it's heavy in nutrients. So many women will be asking me, but doesn't my baby need water? Your baby does not need water. Your breast milk has that part of the water. So your baby will be sucking that fore milk, which quenches the thirst, and then we'll be getting the hind milk, which is the food part of it. So your baby, after that, you will see, after feeding, they will go back, and then they will be resting on your elbow, looking at you and smiling in euphoria, because now they are full, And when you put them up on your chest, you rub their back, they'll be burping as if they drank alcohol. And you know that your baby is full. You can even see with the wet nappies that they are having. They'll be having a lot of wet nappies. They will be having a lot of stool nappies. Then you know that your baby is full. It's the same as you. When you are full, you go to the toilet so many times. So that is also what is happening to your baby. There's nothing different from you and your baby. It's just that you are eating food and they are drinking liquids. And remember, their stomach is small. Very, very small. They say the stomach of the baby is like a measurement of a teaspoon. It's flat and it's small, the stomach. There's a stomach and there's the intestines, because people will say, no, with this big stomach. No, there's a stomach part and there's an intestine part. So the stomach is very small and it can hold a millimeters of breast milk. So your baby becomes full. The problem is that we want to quantify the milk that the baby is drinking, and you won't see. That's why we say breastfeed on demand, meaning whenever the baby shows you the hunger cues, which is they'll be opening their mouth to the side like that. And then when they start now suckling their fist or thumbs, then you know that they are very, very hungry. The late cues is when they start to cry, and we don't want to go there. We don't want to go to that part, because now they are fussy, now they are angry, they don't want to settle down. And that is where we must teach our mothers those hunger cues, because once you start to recognize the hunger cues, trust me, you'll never go to the late cues, because when they are in the late cues, calming them down, it takes the moon and the earth to move it, because they'll be very, very angry. Now, when you know there's hunger cues, the early hunger cues, as I said, then you pop up your breast, your baby will be feeding. And then you will see that your baby is now in euphoria. The baby is comfortable. The baby will burp after that. You took out the wind, your baby will sleep, or your baby will be watching you and playing with you, So those are the things that I like to stress to my client as well.
That's so important. So yeah, no, you explained it super well. Thank you so much. And the cycle and demand thing. What I've also learned, Reveal, is that sometimes, especially our first time mommies, they're quite shocked with the amount of suckling a baby do and how much baby like to be on top of them, and they feel like you need to suck a little bit and then off you go back to bed and you sleep, so maybe you can just explain a little bit that there's more of an understanding on what to expect, those, especially those when the baby is so small and the stomach is so small, as you explained, that what is normal, that the baby actually really like to suck quite a lot, right?
Yes, you. Thank you for that question. Your baby, when they are, especially in the first 3 months, they will be suckling 8 times a day. They will be suckling the whole day. Remember, your baby is not getting water and your baby is not eating any other thing. I always say to my client, how many times do you eat a day? How many times? You say you eat 3 times, but you are snacking in between and you are drinking tea, coffee, water, all those things. But are you expecting the baby also to be eating only 3 times a day without snacking, without drinking their coffee, and without having their water? Because that's everything that they are having in the breast milk. Whatever you are doing, the baby is supposed to be doing it as well. So if you like snacking, your baby will also like snacking because your baby has to snack in between their feeds with breast milk. So I always explain that to them like that, and they'll be laughing and say, sister, but why is the baby want to always be on the breast? I'm saying, yes, it's like you. Every 5 minutes you walk to the fridge, you are looking for something and you want to eat it. Even the baby, every 5 minutes when they wake up, they think of what? The breast milk, and then they want it. So give it to them. So it's normal. It's normal for the first 3 months for your baby to want to be stuck on that breast. That notion of that, we have this notion that a baby is like a doll. We want to feed and the baby must sleep for the next 12 hours. No, that's not it. The concept is always, when I tell them that when you are eating a banana, make sure that this baby is breastfed. When you are eating an apple again, you make sure this baby is breastfed. When you are having your breakfast, the baby must have their breakfast. When you are drinking water, the baby must be breastfed. So you see, the exact same concept that we are doing as adults, we must be applying it to the baby. So they'll be laughing, and saying, hey, but this breastfeeding, the baby wants to hang on the breast. I'm saying, yes, the baby must hang on the breast because you are eating the whole day. They must also eat the whole day. So 8 times the baby and more. That's why we don't want to quantify it as such, because when you give it a quantity and say the child must be breastfed every 2 to 3 hours, mothers would want to follow that strict measure. You understand? Even if the baby was breastfed 2 hours ago, they want to wait for the 3 hours to elapse before breastfeeding, And I always tell them, breastfeed on demand. Know your hunger cues. Your baby sometimes is not hungry. The baby is only awake, and wants to be held, and moved around and look at you and bond with you. Not necessarily that the baby is hungry. Yeah. But because of the notion that our mothers don't know the hunger cues, they think that whenever the baby is awake, the baby wants to feed. Mm. So when we quantify and give it a measurement of hours of when to, then they wait for it, So that is also the big problem, because once you give it a measurement, they want to follow it strictly, But when you say always follow your hunger cues of your baby and breastfeed on demand, you will not get it wrong. Then you won't have measurements in your mind.
Exactly. And there's also like, you're just gonna have to get to know your baby, right? And listen, let a baby tell the story, and it takes sometimes time, especially in the beginning. You're gonna figure out how baby works, what their hunger cues look like. Some babies are fussy eaters, others are easy eaters, so babies are also quite different. So you're going to figure it out, and I think Reveal, what I always am passionate about is on empowering women, that they understand, hey, that they will be able to figure it out intuitively if they get the time, and also that they yeah, that if they are stuck, that I must just get help rather sooner than later from a trustworthy person, right?
It's true. It's true.
Because we can prevent a lot of problems from happening if we just maybe little tips on the right time. Yeah.
Mm.
Yeah, we can
That's
say
true.
so much about breastfeeding, but I think this was really great for today for just the how important it is, the awareness aspect, and then a few threats and things how to overcome it to set you up for a successful breastfeeding journey. And I think the bottom line is if you feel overwhelmed, then get help. We also have a lovely course online, a breastfeeding course, if you want to go more into details. But for this purpose, I think we've covered more than enough. So, reviewer, is there anything you want to say in closing?
I would like to say to all expecting mothers, new mothers, old mothers, it does not matter. Every baby is different. And take your time. As I said in the beginning, breastfeeding is a learned behavior. Sometimes you did not breastfeed your previous babies and you would like to try. Please ask for help. You get the crash course when you are pregnant, but once the baby is here, it's something different. Now you are doing the practical. Yeah. So ask for help. I never stress this enough. Before you leave that maternity unit, that birthing unit, that hospital, ask for help so that you are confident when you also go home. Expect those cracked nipples. The journey of breastfeeding, it's got a lot of things. There's cracked nipples and there's engorgement and all those things. Know how to tackle them. Ask for help. Even in the family, attend the baby wellness clinic with somebody, a friend, your mother, your partner, attend it with them so that when you get the education, when you are maybe scared to ask something, they can ask it on your behalf. You know, because sometimes clients are scared to ask. They feel like I'm the mother. I must know everything. Don't do that. There is no supermom in this world. Yes, there's no supermom. Sometimes you are afraid to ask for help. Somebody who is with you can ask for help in your presence when you are unable to ask it. Then we are able to educate both of you and we are able to sit down and check what is the problem if you are having a problem. You know, that's where we are. That's what we are here for. So breastfeeding is for everyone. It's for the father. It's for the grandmother, the aunts. It's for everybody. What I also would like to educate the mothers, also what I want to stress is expressing, how to express, how to store your milk, you know, and how to carry it home when you are from work and or from any other place where you are separated from your baby. So when we have time, maybe with the next show, we can also stress about that because mothers lack information regarding that because there's a lot of information regarding those things and they don't trust themselves. You know, we buy breast pumps and our hands are the best expression. I, for one, I also bought a breast pump, but most of the time I was using my hands. Yeah. And I hardly ever used it because you know what? Even if you attach it correctly, you felt like it's not taking out all the milk and your hands are touching the correct parts. So I can never stress it enough. Talk to your midwife, talk to your doula, talk to your professional nurse. You'd be amazed the answers that you will get. Or the reassurance. Sometimes you don't need an answer. You just need your reassurance because you are doing it correctly. Just need somebody to say, Mommy, you are on the correct path.
Exactly. Yeah, reviewer, that's beautiful. And I'm going to keep you to it. Let's do a session on expressing milk. That's really good. And for going back to work, because that is also why we're super passionate about that, you get enough breast milk for a long period of time. It's the best for babies. So they're going to be healthy, they're going to be happy, they're going to be thriving. And breastfeeding is the best gift and the best investment you can give to your child for the rest of their life.
And it's free.
So So we're cheering you on, mommy, listener, supporter, breastfeeding supporter. Let us get those numbers up. Let us become the best in the world. I mean, come on, Africa mamas, they should be able to breastfeed easy and naturally. So let's get those numbers up, support one another, make breastfeeding the thing to do, no matter where you are. It's not a shame to breastfeed. It's, I love our mommies that are doing this, and you are doing an incredible job. So that was us for today. Thank you so much, Revealware, for your bubbly presence, and you are so passionate. I love that. Keep up the good work, and it is a joyful thing, breastfeeding, and you completely made that. You showed that today. So thank you so much.
Thank you for having me.
You're welcome. So that was it. We'll see you for our next episode. Bye. Thank you so much for joining us today. If you enjoyed this video, please share this with a friend who will benefit from this. And remember to subscribe and hit the bell icon so that you can be notified whenever we release new videos like this on our channel. We'd love to stay in touch and keep you updated with all our latest content and resources to equip and empower you. So if you're a midwife or any type of birth and baby worker, go to sensitivemidwifery.co.za/free gift. If you're a mom, visit sisterlillian.co.za/free gift for more training and resources. That way we can keep you up to date when we release new episodes like this, plus a few other bonuses. You can also find the links I just mentioned in the show notes. Remember, you're making a big difference because you are shaping the future of humankind. Thanks for watching, and I look forward to journeying with you. Breastfeeding is one of the amazing life experiences a woman and a baby can share, but it's not always easy. The truth is that breastfeeding is a skill, and like any other skill, you need to learn, practice, and be supported in order for it to become second nature. Sister Lillian Center Essential Breastfeeding course will teach you everything you need to know about nursing and how to love your breastfeeding days. Click the link in the show notes or visit sisterlillian.co.za/breastfeeding course to find out more about this invaluable course. And if you're enjoying the content, remember to share this with a fellow mommy or friend.